it said April. I did change that one to August so people didn't get confused. But this is kind of the continuation of the series. We did January, February, and March. And then this was going to be April's. Obviously, we had a few delays. Can everybody hear me all right? Okay, good. So this one is the April seminar, and this one is called Thriving with Good Flexibility. All right? So what we're going to focus on today is the importance of flexibility, the importance of good posture, how posture and flexibility are related, and the importance of preventing bone loss. And last, of course, how can you improve your flexibility, your posture, and your bone strength? Okay? So the first thing we talk about is sharing your gifts and talents is much easier if you can maintain your flexibility, posture, and bone strength, right? You can do more of the things that you love if you have all these pieces that are working together with you. All right? So it's important to be flexible, to be able to do some of the things you love, playing the piano, playing golf. All those things take flexibility. Okay? And posture. You know, everybody wants good posture. It's hard to have good posture, especially nowadays. You know, everybody's bent over looking at things, so you get what you call your tech neck, okay? So these are some of the things that affect it, all right? And bone strength, lastly. So I think a lot of people know about bone strength, but what is it to do to keep your bones strong? All right, so first, what is flexibility? So if you can see this picture there, this is Teo Porchon Lynch, the oldest yoga teacher. She died this past February at age 101. She was pretty flexible, and she was still teaching yoga and enjoying ballroom dancing near the end of her life. This is what we all want, right? We all want to keep doing the things we love until the end of our lives. All right, so the benefits of good flexibility. Flexibility allows you to assume and utilize your good posture. All right, so when I look at posture as a therapist, what do I look at? I look at a combination of things. All right, what we kind of judge is by the front of your ear, your shoulder, your hip bone, your knee, and your ankle. Okay, all of them should be relatively in line. All right, as we get older, obviously things change. Your spine degrades. Okay, so what happens? You know, then you start all kind of coming forward a little bit. Your hip muscles get tight. Your knees bend a little bit. So all these things are changes, but we want to try to limit those and prevent it as much as we can. So what else does flexibility do? Increases how quickly and easily you can move. If your muscles aren't tight and they work the way they should, you can move better. All right? You know, who has trouble getting out of bed in the morning? None of you? Wow, I was going to say, I do. You know, when I sleep all night and I lay on my side and my legs are all curled up, well, that makes my back tight. Yeah. So then I get up in the morning, I'm like, oh, right? Yeah. Okay? But if I maintain those and stretch those muscles every day, okay, first thing I do every morning when I get up is I stretch because I can feel what muscles are tight. Okay, and that affects how I move every day. If I didn't stretch, I'd come in here looking like this. Hey, right? Because those muscles tighten up. All right, so what else does it do? Decreases your risk for injury. When you see professional athletes, what's the first thing they do? Warm up, right? Because that what? Increases your blood flow, helps those muscles get more blood and oxygen that they need to move. Okay? So stretching before anything you do prevents injuries. Or I shouldn't say prevents, but it reduces the risk of injuries. All right? Increases your blood and nutrients to your joints. It improves your coordination. If my muscles are tight, it limits how I move. Okay? If my shoulder muscle's tight and I go to catch the ball, okay? You can't move as fast because that muscle's tight and it's limiting your movements. All right? Decreases pain. All right? So the number one cause of back pain. When everybody comes in, and the first thing I always do if somebody says they have back pain is I stretch. You know why? your back, okay? Think about your pelvis, all right? Here's your pelvis. Now, a lot of times what happens is your hip muscles get tight, okay? So if the front of my hip gets tight, it actually pulls my pelvis. Your pelvis isn't connected to anything, okay? It's a bone, right? It's connected by muscle. So if your hip muscles are tight in the front, pulls your pelvis forward. Well, you got to think, there's always consequences to everything, right? If your front muscles get tight and it pulls your pelvis forward, where does it change the posture of in your back? Okay? Makes more of a curve, right? So that's so important for back pain. You know, you always get people, and I always stretch, and they're like, well, that's not doing anything. I said, well, how do you know? You know, those muscles get tight, and it changes the way things move. A lot, 90% of it is related to that muscle tightness. Depending on how your pelvis is, your pelvis can rotate one way or another. Your spine can rotate. Okay? A lot of times I'll push on people's back to see if there's a rotation in there. Okay? All these things are related to tight muscles. Okay? If your bones didn't have muscles connecting them, could they move? No. Nope. You need your muscles to move your bones. Okay? So in order to move your muscles or your bones in your back and your pelvis muscle, your pelvis bone, those muscles have to be doing the right thing. All right? So of course it can decrease pain. How about improves breathing? What does anybody think of when they think of this? I think of the person that's hunched over like this. I'll tell you what, I can tell a difference in my breathing when I bend over like this. You're smashing your diaphragm, okay? It's harder to take a nice, big, deep breath. So if you have better posture and you stand up straight, it's easier to breathe. That's how your body was made, to stand upright, okay? Again, all these muscles affect how you stand and how you move. All right, last thing, reduces risk of abnormal spinal pressures and osteoporotic changes in the bones. All right, what keeps bones strong? Anybody know? Calcium, okay. Muscles, yeah. Pressure. Your bones actually need pressure, okay? If you just have a bone and you're laying there in bed, it's going to deteriorate. Same with your muscles. Your bones need pressure to keep strong. Okay, that's what builds them, because when you put weight on them, all right, now they're like, okay, I got to support this weight. So I got to be so big and so strong of a bone to be able to support you. So that's what, when anybody's osteoporotic, we often do weight-bearing exercises. Standing up with weight on them, okay? We're going to give you exercises to go with that, all right? Because we don't want those changes, just like your back, okay? If you're sitting and doing exercises all day, all right, you lose that mass in your legs and your spine, okay? As your spine starts, we get older, we know you lose bone in your spine, okay? What happens? Most people come, more and more forward, okay? Well, now you're losing all that weight bearing on the back of your spine. So it's just going to degrade faster. So it makes you shorter? And it makes you shorter, correct. Okay. Right? As we go, everybody gets a little bit shorter. Usually it's not too much, but it depends on how fast your bones are degrading. So it's important to do certain exercises to make sure you're hitting all those pieces. And it's hard. There's a lot of things to think about, but that's what we're here for, to help and say, hey, look, I noticed with your posture, you're just a little forward. Okay, we can work on some of this. As all of us, my posture isn't the greatest. The most common things you see are your shoulders start to round. Okay, your head comes forward. You lean forward a little bit. Not often you see people walk around like this, but it does happen. But most people come forward. All right, let's move on to the next one. So what is posture? Posture is the attitude assumed by the body, either when the body is stationary or when it's moving, right? So no matter what I'm doing, I have a posture. If I'm running, there's a specific posture you have when you're running, okay? And there's something you want to look for. So there's your resting posture. I wouldn't say that's the best. And then you have your static postures. Even look at these people. This person sitting down here looks like on a sports team or something. It's not the most perfect. He's got his head forward looking down. Okay? And then your dynamic posture. So dynamic is when you're moving. Okay? So they're doing some kind of yoga or exercising there. And it's important to make sure you're doing those movements perfectly correct because it's strengthening certain muscles. All right? So why does posture matter? Poor posture can create extra stress on your bones and joints, decrease balance, okay? As I get older, my posture starts to change. What else shifts? Has anybody heard of center of gravity? Okay? Right now, your center of gravity is about S1, which is part of your sacrum and your number one vertebrae in that sacrum. Okay? Well, it's about your belt line. Okay? So as I get older and now I start to go this way, now my center of gravity is lower down, right? Okay, so it changes. It changes my balance because now, I have to compensate for this change. I have something different and now I'm starting to fall, and how do I change this? How do I compensate for it? Okay? So that's a huge piece. Poor flexibility, okay? As we get older, the further forward you go, I can only lift my arm up this high. But that's because I'm forward. If I stand up straight, it's all the way up. Okay? Increased risk of pain or injury. Do you think it feels good to walk like this? Muscles get tight. If I'm like this, now my abdominal muscles are shortened. Okay? When I stand up straight, they're long. Okay? If I hunch over, they have to shorten up. Your back muscles, when I hunch over, they're elongated, so they're stretched out. And that hurts, causes pain. And a lot of times people come and they have pain. I'm like, we can't fix it until we fix your posture. Okay? It's going to limit the pull on those muscles to decrease that pain. It can also affect the ability of some organs to function properly, like your lungs. Like a car that is out of alignment, poor posture can result in increased wear and tear on the body. All right? Let's say you're running all the time, okay? If for some reason your hip muscles are tight, now you're running a little differently, okay? So what's going to happen? Your knee joint is going to wear away. Has anybody ever seen people have their knees like this or bowed? It's because their posture was wrong, and now their bones have worn away on different sides. When your bones wear, like your knee, it should wear evenly across both ends. There's two sides to your knee, should wear evenly. You have poor posture, it's going to wear on one side. That's why you see people with knock-kneed or bow-kneed, okay? Good posture can help you breathe better, move better, improve your balance, keep your bones strong, and decrease your pain. So what affects posture? Joint stiffness, right? Your joints get stiff in the back, your back gets stiff, all these things. Muscle flexibility and strength, messages from the brain, right? Brain kind of controls everything. Pain. So if your back hurts, are you going to stand up straight if it hurts you to stand up straight? Nope. You're going to hunch over. It feels better like this. It relaxes it. Let's say you have a herniated disc. Okay? Feels better to hunch over. Well, eventually, it's going to stay like that. Your muscles are going to get weak. There's going to be muscles that get tight. And then you go to stand up and you're like, I can't. It's too tight. Too tight my abdominals. It pulls. All right? So we have to be very careful when that's why I tell people, as soon as you start to feel something different, let me know. Because it can make a big, big change in what's going to happen in the future. A lot of times, has anybody heard of adhesive capsulitis in the shoulder or frozen shoulder? Okay? So what happens is if you damage your shoulder, okay, what happens? People don't move it. You just sit there. It hurts. I can't move it. Well, you wait too long, and what happens is your capsule in your shoulder joint actually binds to the bone, okay? Then you know what? And you can't move it. It's stuck. That's it. No movement whatsoever. I got a story. When I was in high school, I fell and hurt my ACL. Didn't think anything of it, so what did I do? I laid in bed all day, kept my knee bent, okay? That's all I did. For about 5 days, went to the doctor and said, oh, you tore your ACL. Okay. First day I go to therapy, and this is it. I cannot straighten my leg. What happened was my hamstrings were because I was very active. I ran, I exercised, but it was such a shock to my muscles of not exercising and not stretching that my hamstrings just binded up. So my leg was basically stuck like this. They took weights to try to straighten my leg out, okay, because the scar tissue had started to build up in there already. Okay? So any kind of movement, anything that starts to happen, make sure you jump on, okay? Any change you notice. Oh, so we talked about bone loss, osteoporosis, okay? The more exercising the better it's going to work for you, especially with weight-bearing exercises. The more weight and pressure you can put on those bones, it's like making a diamond, right? How does a coal turn into a diamond? Years and years and years of pressure. Your bones need pressure to maintain their strength, okay? If you lay in bed, your bones are going to deteriorate. If you're not up and walking as much as you possibly can, your bones are going to change, same as your muscles, okay? Resting postures can affect active postures. If I sit in a chair all day like this, all slouched over, if I sat there for 8 hours like this, I'm going to stand up, my back's going to hurt, my shoulders are going to hurt, my hips are going to hurt, and then I'm going to walk around like this. Oh, I sat like that. Now my shoulders didn't have any support, my back didn't have any support. Now it's all hurting. Whew. That's why I feel like some mornings, after you work a whole day outside or you're doing something, and I go to stand up and it's like, oh, I got to push everything back and align it all back up. Okay? But if you do that for long periods, you're going to be in trouble because then things don't want to move the way they used to. Most common postural problems as you age. Mostly related to spending increased time in flexed postures and generally sedentary lifestyles. All right, look at all these things. What is everybody doing? They look like they're having some fun in some of these pictures. Sitting at the beach, eating dinner or breakfast, on the computer. Looks like they're probably paying some bills. That actually looks like an Axe bill to me. So, did you see that? I see the little Axe logo up there. Taking a nap. But look at their postures as they're doing all these things. Okay? Is anybody standing up straight or sitting up straight? No. Now, do I ever expect it to be perfect? Yes. No. I'll tell you what, I don't sleep like that, but I don't sleep perfect. Okay? I adjust for the way things need to be. Okay? I put a pillow between my knees because that helps me feel better in the morning. I try to just use one pillow so my neck isn't all out of shape. But just think about those things. Try to be conscious of them every now and then. If a couple days and you wake up and you're like, man, my neck's sore. I wonder what's going on. Well, evaluate what you're doing. Think about it. Look at it. Yes, ma'am.
You sleep on your side?
I do. Yep. And as you get older, less people sleep on their stomach. I try to sleep on my stomach because as a posture and flexibility thing, that's the best way to sleep. Really is. It is because what happens, look, you're sitting in a chair, right? So all the muscles in the front are all tightened up. So the best way to lay down is flat on your stomach because it stretches everything out. Now, I wouldn't recommend trying it because most of the time as we get older, it hurts to lay flat. It's harder, okay? Compresses your lungs a little bit. Your back usually hurts, But I can do it for a little bit. I can tolerate it, but, it's just not comfortable, okay? I like to lay on my side. But when I lay on my side, I usually flex my knees up. Okay, but when I get up in the morning, I got to stretch, and I got to make sure I do that. Okay, and I put a pillow between, because think about laying on your side. This leg's coming down. Well, unfortunately, you got muscles everywhere. So now these muscles on the side of your leg are being stretched out. Okay? So I know it's a lot. It's overwhelming at all the little pieces to look at. But when you start to say, "Ooh, man, I'm not sleeping very well," or "this hurts when I get up," it's the first thing you should look at is how you sleep, because it affects a lot of different pieces. Sometimes I'll hug a pillow so my shoulders, when you sleep, sometimes you roll your bottom shoulder in. That stretches out the back. All right? So, all these little pieces. And sometimes they are very little, but it affects different things. All right. Fixed postures over time can lead to changes. Okay, so we've talked about some of this. In your joints, muscles, and bones, in poor flexibility and poor posture. So what we call kyphosis, or forward head. Okay? Headaches. All right, does anybody know why you'd get a headache? Okay, so your head weighs what? 10 pounds, 8 to 10 pounds on a normal thing? All right, your spine kind of comes up like this. When your head starts to go forward, okay, you're displacing that weight now on less vertebrae. Okay, so your vertebrae and your neck is kind of like this, and now it's coming forward. So think about that. Now instead of having weight like this, now you have it kind of like this. Okay, so everything kind of relates a little bit to physics too. Okay, so you're shifting the center of gravity of your head. Okay, so that tends to stretch out these muscles right back here. The muscles that connect your spine to your skull are little tiny muscles, and there's a lot of them. Actually, I tell people all the time, if you got a headache, usually I can relieve it by just doing a little pull by putting my fingers right underneath your skull. Okay, but as your head goes forward, those muscles get stretched out more, and it causes tension. Tension headaches, okay? Shoulders, your shoulders get tense. So everything's kind of shifted. So now you got a new center of mass, all these different things. So that's where your headaches come from. Balance issues. Same thing. You're moving your center of gravity. Okay, right now, I am perfectly balanced. If you lean me forward like this and tell me to walk, my balance is going to be totally different because now I've shifted that center. Breathing issues, okay, same thing. You coming forward, you're compressing your diaphragm. It's harder to breathe. It's harder to open up your lungs. All right? Compression fractures. All right? So we're going to keep going back to the same thing. You're shifting your weight on your spine. Here's your spine kind of makes a very slight S. Okay? And then you shift it. Now you got more weight on certain pieces of your spine. That's why you get those compression fractures in your lower back and sometimes your mid-back, okay? Because it's degenerating, okay, already. Your bone, you're going to lose bone as we get older. We typically do, and muscle mass, okay? But as that happens, you're shifting the center of gravity and where all the weight gets put, okay? So think about that. Rounded shoulders gives you breathing issues, pain in your shoulders, dysfunctions, and balance issues. All right, see that little video down there? Stiffness or weakness in one area affects the whole body. Tight hips and knees. Now, every single person I have ever met has tight hips because not many people, not many at all, stretch what I call their hip flexor. Okay, I know Jonathan talks about the hip flexor in exercise class. Now, everybody knows where your quads are, or at least have heard of those. Okay, your quad is 4 muscles, and they're big. They're big muscles, okay? But out of those 4 muscles, only one of those connects to your hip, okay? But behind that, you have a short muscle. It's probably about that short, okay? But it's probably about that big around, okay? It's a huge muscle. It's called your iliopsoas, okay? The only way to stretch that muscle is to get your hip or your leg behind you. Okay? Now I teach people to do this all the time. You can lay on a bed. Okay? If your bed's got a little elevation to it, you can drop your leg. Okay? Your leg's behind you. Okay? But I see people all the time stretching and they're doing this and they're like, oh, I'm stretching my hip flexor. Nope. You're stretching your quad. It sort of feels about the same, but I can really tell if I lean forward, all right, I'm putting my hip behind me and I lean back, I can feel it right there. Okay? Right at the top where it connects to my pelvis. Okay? Because tight hip muscles is the key. It really is, especially for back pain. All right? Limited knee extension. So what does that mean? Getting your knee straight, stretching the hamstrings. All those big muscle groups are really important. But also, we really need to narrow in what is your issue and where is it coming from. The body has, 256 common muscles? Okay? So think about that. There's not one solution for everybody. Sometimes it may be a smaller muscle. Sometimes it may be a bigger muscle. Sometimes it may be a combination of a bunch of muscles. Because all your muscles have to work together to move your body. Okay, so what happens? Slower gait, walking, balance issues, leg weakness, back pain. There's that back pain again. So what happens? Decreased trunk rotation. What's trunk rotation? How your trunk turns. So when you walk, right, your trunk has to turn. Very slightly, and not many people notice that. But as a therapist, I notice that. That's something I look at. One of the first things I look at, too, is arm swing. How many people actually swing their arms a decent amount? Because the less you do, that more says, okay, you have something wrong with your shoulders are bothering you, okay, or your posture. Because the more forward you come, the less you swing your arms. Okay? Limited ankle movement. So your ankle is a very big piece and a key to balance. All right? Like I've said before in other presentations, your feet have what's called proprioceptors in them. What proprioceptors do is they tell your brain, hey, I'm starting to lean to the right, it's too far. Okay? That comes from your ankles. All right? That's the biggest place where you have proprioceptors. So if you have ankle weakness or any deficits in your ankles, your balance is going to be affected, number one. Okay? Leg weakness, and again, you're going to have walking deficits, gait deficits, different things. So osteoporosis. So what is osteoporosis? It's a disease that weakens the bone and increases your risk for fractures. All right? Osteopenia is a condition that happens when your body gets rid of more bone than it's creating. Okay? So does that make sense?
Yeah.
Your bone is deteriorating more than your body can regenerate it. Bones are weaker than they should be, but not as fragile as seen in osteoporosis. So usually they'll say you're osteopenic before you're osteoporotic. Okay? So you want to try in that stage, you got to say, hey, all right, I need to make a change. What can I do differently? I want to maintain my bone growth, and I got to maintain my muscle mass to be able to move those bones right. So maintaining healthy, strong bones is one of the most important things we need to do as we age. Making a commitment to a safe exercise program to maintain flexibility and strength in order to promote good posture and less stress on the bones can play a significant role in keeping your bones strong. All right? Does that make sense? We want to make sure our bones are strong because we don't want to fall and hit your hip and then you fracture it. Okay, so we want to make sure that we're maintaining that strength as much as we can. And that's why I said, when we look at somebody that has osteoporosis or osteopenic, we're looking at weight-bearing exercises. We really want to do some weights training, okay? Because that really puts that stress on the bone that it needs to grow big and strong. All right, so this is kind of a picture of what osteoporosis looks like. Can everybody see that all right? Might be a little far for some. But what it looks like is your normal bone has your, I don't know what I want to call it, but an osteoporotic bone is more porous, okay? It's not as tightly wound, all right? So osteoporosis bone weakens the bone where it tends to crush more easily, okay? Especially if unforeseen forces or uneven forces are put on that bone, all right? Most common fractures are seen in the spine, right? Compression fractures, the hips, all right? A lot of people fall, you hit your hip, that's where you're going to break. And the wrists, okay? Because these bones are already pretty small, and usually when you fall and you put your arm out, you know, your wrist bones are taking a lot of pressure and weight from your body. So that's why you see that in your spine, wrists, and hips. All right, so risk factors, something that's not modifiable. So that means we can't change it. So unfortunately, if you're female, you're already at a disadvantage. If you're over the age of 50, sorry, there's another disadvantage. Small, thin frames. Okay, you know why? Like I said, your bones need weight. Okay, they like it. That's a good thing for them. All right, if you're Caucasian or Asian, I'm sorry. All right, but things we can modify. Lack of weight-bearing exercises. Okay, so this is really important. We've stressed this all day. All right, smoking, alcohol consumption, anorexia or eating disorders, low calcium and vitamin D. I like this next one, lack of exposure to sunshine. Does everybody get outside every day, or at least try to for a little bit? Get that sunshine. It's good for your bones. Low hormone levels, and last but not least is your medications. You know, so that's some of the side effects, you know, bone loss in some medications. So just be careful. Ask your doctor. So what can you do to promote better posture and health? So make sure you're proactive. And I always tell people, you know, when I see people, it's usually too late. People say, hey, oh man, my shoulder's been hurting me for 3 weeks. And, you know, I didn't think there was anything there, but I probably should have come and seen you. Well, I tell people, don't wait. As soon as you think something's not working or not feeling right, come let me know. And you know what? We have no problem telling people, hey, everything's good. Maybe you slept wrong one day, you're okay. I am glad to say that to you, and I would be happy to. You don't need me. But the chance of you needing us is probably higher than you not needing us. If something feels wrong, okay? So anytime something you're like, ooh, you know, that feels a little different, I'm not sure what's going on, call us, say, hey, look, this is what's going on. We can kind of direct you a little bit. But most of the time I'm going to say, hey, call your doctor, get an order, come and see us, and then we can really do a thorough evaluation and see what's going on. All right? Talk with your doctor about bone density tests and recommendations for specific for your body. All right? None of us in here are the same. We all have different things. We have different postures. We have different muscle strengths. We have different bone strengths. Okay? So that's what it's important to make sure we're getting something for you. Not tailored to everybody, all right? Try to spend a significant amount of time every day in upright and extended postures, right? Standing up, walking around, talking to people. Just be conscious of how your posture is, all right? Believe me, I know that's hard. Everybody has bad posture these days. Okay, I tell my kids, they'll sit at the dinner table, you know, they're sitting there eating like this and playing their video games. I'm like, oh, just stand up straight. And they look at me like I'm crazy. Other important things you can do. Participate in a Thrive screen. So our Thrive screens, you know, there's like 5 different pieces on there. Well, they're designed to look at your posture, your flexibility, your strength, your balance. I always forget the last one. Mind. They're made to screen those things, so that's kind of the precursor. Okay, hey, you know, you're what we call an occiput to wall test is one of them we do, and I would probably fail it too. You stand up straight and you see if you can get the back of your head to the wall. If you're more than, I think it's like 2.2 centimeters, you're at risk for a compression fracture. But see how small that number is? 2.2 centimeters is about that big. That's what, a little over an inch, I think. All right? So that big of a change in your head forward, and you're at a higher risk for compression fractures. Okay? Oh, there it is. Occiput to wall test, one of our standard tests on the Thrive screen. Okay? So consider PT or OT. Your therapists have many tools. So ACTS has spent a lot of hours and a lot of money investing in different programs for us, especially the Thrive program. I know they've beat it down our brains, and I'm sure they're beating it down yours too. But it's designed to help catch things before they happen. Because the thing I hate the most is seeing people come down the Willowbrook and we're like, well, what happened? You know, just the other day I was like, well, what happened? Why are they down here? Oh, this, and this happened. I'm like, well, man, I could have done something. I really could have. And a lot of times we can. And sometimes it's something simple, sometimes it's not, and sometimes we can't do anything. Okay? There's all different things, there's all different people here, but there's always an opportunity, always. Okay? So we have many tools for flexibility and posture, contributing to your complaints, putting your risk of increased wear and tear, and we develop programs specifically designed for you. Okay? So when we do a Thrive screen, I look at all those pieces and I say, hey, your posture's not so great. Now I'm going to do an evaluation. When we do that first evaluation, usually we do between 2 and 3 tests on you. I don't want to say tests because they're not tests, assessments to see exactly what's going on. Those assessments are very well researched and widely studied, so it's good data for us, but it shows us kind of where we need to go. And that's what we're trained to do, to say, hey, this is what specific is going on, this is what we need to tailor our program to, so it's just for you. So what do you do next? I don't know why her name is on there. It shouldn't have been.
Talk to you.
Yep, talk to me. Talk to Angel. You can call down. You guys know that Angel's always in there. Somebody edited this and shouldn't have. Chat with a therapist. So I'm going to start that probably sometime this month, where we're usually available in town center for about an hour every day, once a week. But I mean, you guys can always call us. We are always around in the halls. I'm up here probably 3 or 4 times a day. Just stop one of us, any of the team, and just say, hey, look, I was thinking about my posture and I want to get it looked at. They'll take your name and your number, and we'll call you, we'll set something up for you. You can call the office, Angel will schedule something for you. It's quick and simple. These Thrive screens, depending on, sometimes I like to do a couple of them on a different piece. Let's say I do arm strength and you scored right on the cusp. I'm like, well, let me do a different one that looks at something else. Usually it takes 15 to 20 minutes, okay, to do an entire Thrive screen. It looks at all 5 of those principles: flexibility, strength, balance, mind, and I can never remember the last one. And cardiovascular, energy, okay? Because that's a big piece too. You want to have the energy to do the things that you enjoy, okay? The next presentation is going to be 2 weeks from today. It is, I'm going to post it. I'll put the ad up today. I'm pretty sure it's on flexibility again. So they're running behind a little bit, but I will get that and put it on the TV. But it's going to be 2 weeks from today, in here again at 11 o'clock, and kind of the same format. I'm going to go, that will be May's presentation. So until I kind of catch back up to the current month, we'll do 2 every month until I catch back up on every 2-week basis. There it is. May Rehab Seminar is Thrive with Good Strength. Learn about arthritis, back pain, shoulder pain, and our chronic pain management program.
Is it 2:30 or 11?
It is at 11. Sorry. These are designed by corporate, and then we just pull them up, but apparently somebody edited it. Any questions, comments? Yes, ma'am.
You sleep with a pillow. Is this a little pillow or is this a bed pillow?
So I put a regular sized pillow in between my knees, because what I want to try to do is I want to try to keep them about shoulder width apart. Okay, so it's probably 4 inches in between my knees. Okay, so my goal is to try to keep it about shoulder width apart. Yep, so I just put a regular bed pillow. Especially if you have back pain, that's really good because it helps to keep your hips in a line. Okay? When you drop a hip, sometimes you get some pull on the side, and then it also, you got to think about all the pieces that are connected. So you drop that hip, okay? Now your back muscles are pulling too. So there's two key muscles with back pain. We talked about your hip flexor. Well, there's also a muscle on your side here. It's really big, and not many people really think about it a lot because you probably have never heard of it. But it connects to your spine, it connects to your pelvis, and it connects to your ribs. It's called your quadratus lumborum, okay? And you literally stretch it by doing side bends, okay? But I will tell you what, most of the time, if you stretch those two muscles, your back pain will decrease significantly, okay? But it's also making sure you're doing it right and not hurting yourself by doing other things, okay? You should feel specific pulls in different places, okay? When I do this, I feel it right on the top of my pelvis. Some people feel it on their rib, okay? So it just tells us a little bit of a different story when you do that and you feel it in different places. So just be careful. Any other questions? Well, thank you all. I appreciate you all coming. That was good for the first one. This is really nice to be able to do this again.